Hi, it's Michael Goldberger. I am one of the foot and ankle specialists at Tri-County Orthopedics. Ankle arthritis is the end result where the protective coating around the ankle joint or cartilage wears away. There are 100 different types of arthritis. When most people think of arthritis, they're thinking about osteoarthritis, which is age-related wear and tear. The ankle is also prone to having fractures or sprains, and this type of arthritis is called post-traumatic arthritis. Lastly, people who have inflammation or inflammatory arthritis or rheumatoid arthritis are also prone to developing changes in the ankle joint. The people at risk most commonly for ankle arthritis are people who had previous trauma, whether it's previous fractures or sprains. Also, people who have history of inflammatory arthritis called rheumatoid arthritis are particular risk for ankle arthritis. Lastly, although less common in the hip or knee, osteoarthritis also affects the ankle. The signs and symptoms of ankle arthritis can be simply pain, swelling, and stiffness in the ankle joint. Over time, a patient may notice their ankle changes shape, and the end result is they have difficulty with prolonged walking or standing. Ankle arthritis is most commonly diagnosed by physical examination. We would expect to see loss of range of motion, swelling in the ankle joint. In addition, we would get x-rays to examine how much cartilage is remaining and look for bone spurs. Rarely, at the very early stages, ankle arthritis is diagnosed by MRI. Depending on the severity of the ankle arthritis, there are several non-operative choices. First of all, modification of activities is the mainstay of treatment. For instance, if you are a runner, maybe doing a elliptical machine or bicycle is more appropriate. Secondly, a supervised nutritional weight loss program is appropriate. Next, you can use a cane, occasionally an orthotic. Next, there are specialized sneakers which compensate for loss of ankle range of motion. In addition, pain relievers or anti-inflammatory medicines may be appropriate. And lastly, on occasion, injection of steroid medicine into the ankle joint is appropriate. In the early stages of ankle arthritis, arthroscopic surgery may be appropriate. In arthroscopic surgery, we can remove loose fragments of bone and cartilage and even remove bone spurs. In more advanced stages, ankle arthrodesis is appropriate. In this case, the bones are welded together with plates and screws. Lastly, ankle arthroplasty or total ankle replacement is now being used in select patients. The postoperative instructions vary with the surgery performed. In someone who had arthroscopy, typically we recommend ice and elevation for 2 or 3 days, then early walking. In someone who had an ankle arthrodesis or replacement due to pain, they're typically in the hospital 1 to 2 nights. We recommend elevation above the heart for 1 to 2 weeks. In someone who had an ankle fusion, you're typically in a cast for about 2 months. In someone who had an ankle replacement, typically put you in a walking boot and early range of motion is begun.